Hello, I'm Emma Tyson. I'm an anaesthetic ST6. I work with Sethunath, who's an anaesthetic CT1, and Brian Johnson, who's a senior ADP. Work at Ashford and St Peter's hospitals. I'm going to talk to you about our project, patient positioning training for anaesthetic resident doctors. Why did we do this project? So harmful incidents related to patient positioning do occur. Although they're not common, the consequences can be severe. Patient position knowledge, execution and effective teamwork are key to maintaining patient safety in theatre and reducing the risk of peripheral nerve injury. Anaesthetists play a key role in this. The 2021 curriculum states in the initial assessment of competencies that safe patient positioning is needed, but it's actually not that clear in stages 2 and 3. So we thought there are potential knowledge gaps and the opportunity to do some practical teaching. What did we do? So we asked resident doctors to complete an online survey about their previous patient positioning training, their confidence and their role in patient positioning in theatre. We then ran a teaching session, which was a knowledge session, followed by practical positioning teaching by Brian, our ODP. This teaching took place during anaesthetic weekly departmental teaching. We borrowed a spare theatre operating table, attachments and positioning aids. Resident doctors were able to volunteer to be the position patient and practice using the positioning aids. Teaching included common patient positions, most frequent nerve injuries and prevention strategies. What results did we get? Well, between pre and post-course survey, our respondents changed their views as who was responsible for safe patient positioning in theatre. Our respondents felt more confident in their ability to safely position their patients after the teaching session, and as we expected, not many of our respondents had any formal teaching on safe patient positioning. All of the people that took part in our training would recommend this teaching session to other people. And the percentage of people who said they would routinely consent for nerve injuries under general anaesthetic increased after the teaching session. So in conclusion, we would say that delivery of resident doctor patient positioning training is a valuable addition to the teaching programme. It led to increased awareness of issues surrounding patient positioning, an increase in the number of doctors that said they would routinely consent patients for it, and it was a useful practical session working with our ADP. Thank you.